Thanks for everyone for coming. My name is Kiel and my son is Isaiah. He was born 7.5 weeks early and spent 3 weeks in the NICU. Many health professionals saw my son during this time. Despite this, it was my wife who diagnosed Isaiah's tongue tie at 2 months. She soon saw that I was also tongue-tied, which was previously undiagnosed. When Isaiah's lip and tongue ties, we knew we needed to get them revised right away. We booked an appointment at the local breastfeeding clinic to have his tongue clipped with scissors. They clipped it, but not far enough. So he was still having issues breastfeeding. When we saw a pediatrician, she told us that we'd have to wait to see if it affected his speech. So at around the age of 2, if he needed She told us that we'd have to wait to see it affect his speech. So if around the age of 2, if he needed, she would make a referral to a plastic surgeon. So we gave up for many months until we read Joanna's blog post and realized there was another option. At a year, he still couldn't move food around in his mouth and ended up spitting most of his food out. It also seemed he was having lots of health issues at the time. Because his tongue made him unable to eat solids, he was anemic. This made his immune system weak, so he caught everything, including RSV. His head length and weight percentages not only did not match, they were not even close. This is when we knew we needed to do something. We found that Dr. Kalu in Albany was the leading expert when it came to lip and tongue ties. Shortly after, we were on a plane to Albany to have Dr. Kalu do the revisions. Dr. Kalu used a laser for the revisions, and immediately after the procedure, Isaiah was able to latch better, move food around in his mouth without spitting it all out. Because he got very sick after the revision, and we stopped stretching the site properly, he required a second revision by Dr. Kalu. Since then, Isaiah has been doing much better. He's gaining weight, is no longer anemic, and is not getting sick nearly as often. But his weight and height have not caught up to his head circumference. I only wonder how much better he would be doing if he was diagnosed and revised sooner. This leads me to wonder about my own lip and tongue ties. I had a severe tongue tie which prevented me from breastfeeding. I had pain when I would try to stick my tongue out and had speech issues when I was younger. I had to have speech therapy as a child. As an adult, I started grinding my teeth quite severely and now need to wear a night guard. Since my revision, I no longer have pain when I stick my tongue out, but I've yet to notice any other benefits. This makes me think that the structural damage of being tied for 28 years is not completely reversible by having the procedure done later in life. The earlier the revision, the less the chance of secondary symptoms developing. I wonder how different my life and health would have been if I was revised as an infant, so I'd have been able to breastfeed. Babies deserve better than this in Alberta. Assessment and best practice treatment need to be available locally, and the trip to the dentist office needs to be paid for by Alberta.